the board moved at the last meeting, I did write the confidential letter, as Mr. Eberly mentioned. I provided him a copy in a sealed envelope for distribution to his school. Presumably, that copy, despite being a protected educational record, was shared with the state. It will be up to Mr. Eberly and his attorneys whether a violation of the FERPA occurred as a result of that sharing. But regardless, I do think it's helpful that the state has issued this interpretation, because as Mr. Eberly mentioned, it does corroborate his position that the state's actions are arbitrary, they're capricious, and frankly, they're increasingly petty, right? This is very petty, bureaucratic action. And I do believe the broader context is important to consider. There's a high degree of personal animus between this particular state official and myself. I think it actually rises to the level of derangement. And I suspect that they will regret having written this letter. I don't think this was reviewed by their legal counsel. I don't think they've considered the broader implications of stating these things in writing, because this will very likely prove to be Exhibit A in the inevitable lawsuit that will be filed against the state under the Michigan Administrative Procedures Act for the arbitrary and capricious interpretation of the regulations by the state. So what you should have before you is a letter that I've just seen today. This was a letter written by state officials to our health officer, Liz King, and you should also see the revised medical exemption form, which the state claims they updated in response to my letter. That's not true. They wanted to replace the CDC recommendations with the American Academy of Pediatrics recommendations, but that's beside the point. In your packet, you should also see the letter that was written to the superintendent at Armada Schools, and then in that packet, I have enclosed some highlighted excerpts of the relevant statutes and regulations that the letter references. And so what I'd like to do is I'd like to go through the letter to the superintendent at Armada. And as you can see, the state's argument is that the words waiver and exemption are synonymous. This is an important development because there is no legal basis for this interpretation. This is a decision that the bureaucracy is making, and if they hold to this interpretation, this may have relevance in subsequent legal decisions. The state's fundamental argument is that when a physician issues an exemption, as the board instructed me to, and as I agreed to do in this particular case, that exemption is, per the state, equivalent to a waiver, and all waivers must be written on an appropriate form. That's fundamentally the state's argument. Now, state regulations cannot contradict statute, and they have to be consistent with the intent of statute. And in your packet, you'll see the underlying law, 333-9215. A child is exempt from the requirements of this part as to a specific immunization, and if a physician says the specific immunizations are all exemptions, that is clearly adequate, to a specific immunization for any period of time as to which a physician certifies that a specific immunization, i.e. all immunizations, is not appropriate. So there are two criteria, just to remind the audience and the board, there are two criteria whereby a physician can determine that immunizations otherwise required by law are to be exempted. The first is if it may be detrimental to the child's health, i.e. medically contraindicated, or is not appropriate. So the legislature has acknowledged that there are situations where the vaccine is not inherently detrimental to the child's health, meaning it's not medically contraindicated, but it's nonetheless inappropriate. And I believe this is ultimately going to be decided by a court, but I believe it was the intent of the legislature to acknowledge that there are ethical situations, there are other considerations that a clinician or a physician can determine other than medical contraindication that permit a physician to exempt their child. This was the authority that I used in my letter to write the exemption for Mr. Eberly's children. Now, if you look at the medical contraindication form that the state is stating I must use, there is no acknowledgement of the separate appropriateness exemption authority that is granted by law. right? A child, what they say that the law says a child is exempt from these requirements for any specific immunization for any period of time for which a physician certifies that a specific immunization is or may be detrimental to the child's health or is not medically appropriate. You see what they've done there, right? So they have rewritten the law. Now, arguably, we are arguing that Eberle's children cannot receive the vaccines because it is medically, ethically inappropriate, right? This is the argument, that he's otherwise met all of the requirements for a conscientious objection. He's received the required education. He simply doesn't want to complete the form, right? This is it. And the state is insisting that he either complete the state-mandated non-medical exemption form, or that I, as the physician making the appropriateness exemption determination, complete this form. But this form is not appropriate for this purpose. Now maybe the state is throwing me a bone here. Maybe the state is conceding our point by saying that it is not medically appropriate. You see how the form has been updated relative to the earlier form that you should have in your packet, right? They've added this language, is not medically appropriate. Now, I suppose I could complete this form and say this is not medically appropriate due to lack of informed consent, due to the family being pressured into having an encounter that they don't consent to, right? It's not appropriate for them to be vaccinated solely for administrative purposes. But this is, I think the purpose of this form is to undermine the appropriateness exemption. Nowhere do they use that specific language in the law. They say medically appropriate. And my concern would be that what the state is going to do is they're going to say, well, Dr. Nevin, we've seen your form. Thank you very much for completing it, but we disagree with the medical rationale. This is fundamentally a medical ethical determination that we have made, that it's inappropriate to coerce parents into vaccinating their children without a full and informed consent. So we have a choice to make, and I'll defer it to the advisory board how we may wish to proceed. I would propose that the state has articulated their position in the form of a non-binding letter, right? If the state feels confident enough in their interpretation, they would agree to commit their interpretation to something called a declaratory ruling. So they are interpreting their powers under the regulation. And in Michigan, a state agency that is adopting a position that the law or the regulation means X or Y, they have the authority to issue a declaratory ruling that formalizes that interpretation. One potential way forward to this impasse is for us, either myself directly or the board asking Liz King, including through counsel, is to ask the state to formalize their interpretation of what does or does not constitute an appropriateness exemption in the form of a declaratory ruling. Now, my expectation is the state is going to simply pass on that, and they're going to say, well, you know, we think this is a matter of pending litigation, and so we're going to defer or decline to issue a declaratory ruling. But I think this may be the way to formalize the state's response in anticipation of potential litigation. Another option is that we can submit a Freedom of Information Act request for the form that the state declares a physician should use in the event that they are issuing an appropriateness exemption, right? Not a medical appropriateness exemption, but an appropriateness exemption under the law, using the exact statutory language. If the state returns this new medical exemption form, then this would be akin to the state acknowledging that an appropriateness exemption of the type that we have recommended for the Eberle family is indeed appropriate to put on this new form. And I may do this over the holidays. The last thing that we could do is we could ask Liz, in her role, including potentially with the advice of counsel, is to issue a response to this letter. Not the letter to the superintendent, but the letter to her personally, stating that the department disagrees with their interpretation. The department, at the direction of the Advisory Board of Health, strongly supports Dr. Nevin's having written the exemption, noting that the state does not seem to have clearly articulated a path for physicians who believe that vaccination, compulsory vaccination, is medically, ethically inappropriate, articulating that the state has not clearly articulated a path for physicians to complete an appropriate form, and asking the state to respond with the declaratory rulings that we've requested. I suspect that if I do complete this form, that the state is going to reject it. I obviously can't predict with certainty what the state's response will be, but my expectation is that the state is essentially setting a trap, and that they want me to commit to completing a form that they will then use as an argument that I'm, being medically inappropriate, acting outside of normal behavior for a physician, and so on. And so my first instinct is to not complete this form until and unless the state formally acknowledges that it is the appropriate form for appropriateness exemptions. And I'll be happy to take advice and counsel of the advisory board in this regard.
So just to clarify,
No.
You're saying you want an interpretation from the state regarding, you want them to say to use this form?
Yes, yeah, that's precisely right. So as I mentioned, to Mr. Eberly, and as I believe I discussed at the last meeting, in the same way that Mr. Eberly doesn't want to complete the state waiver form, he doesn't believe that the regulations require it. He believes the law is clear and the regulations are a corruption of the legislative intent. So too do I believe that the legislation clearly grants me the authority to exempt his children for reasons of appropriateness on a simple letter, as a plain reading of the law would imply. So I have reservations about completing this form now, just as I did before we issued the letter. Now I would be willing to complete this form if the state explicitly acknowledges in the form of a declaratory ruling or in response to a Freedom of Information Act request that this is the appropriate form for physicians to use when they are exempting a child from the mandatory immunizations for reasons of appropriateness. And the reason I'm hesitant is because the state has said medically appropriate. Instead of appropriate, they are interpreting the law and they're adding their own color, and I think this is a trap. And I don't fall for traps. So, and additionally, if the state is using this process to further obstruct what are statutorily legitimate exemptions, then a court is going to look at this process and say, yes, very clearly, this is Exhibit A in the arbitrary and capricious and petty nature of the bureaucracy.
Madam Chair, may I?
Yes.
Thank you. So, Dr. Dever, what do you want us to do?
So I would be pleased if the board were to entertain and vote on a motion that would, for example, direct the health officer to respond to this letter, explaining the context, explaining that this is supported by the department and the Advisory Board of Health, that the department believes a plain reading of the law permits physicians to issue exemptions for reasons of appropriateness, that this is a situation where it is medically ethically inappropriate for Mr. Eberly's children to be subject to compulsory vaccination, requesting the state reissue their letter in the form of a declaratory ruling specifically focused on whether appropriateness exemptions are also subject to a waiver form requirement, and if so, what is the form, and is the newly updated medical exemption form the appropriate form for a clinician to enter an appropriateness exemption, right? Essentially, if it pleases the board, I would certainly be happy for there to be a motion that has Liz, in her official role as health officer, having been the recipient of this letter from the state, to push back against what I believe the Health Advisory Board may view as the abuse of the state, and ask for a series of very reasonable actions from the state to clarify their position.
Madam Chair. Madam Chair?
Yes.
Can I speak?
What?
I have a question. The reason why, before he's asking for a motion, before I think anyone's considering a motion, first I need to jog my memory. This family is, Armada's in Macomb County, correct?
They're St. Clair County family.
But because it's St. Clair County family,
Yeah.
Macomb County schools, this is happening. Did Macomb County Health Department weigh in at all? Did you address this with them?
So based on the fact that no similar attention to this issue has been paid by the Macomb County Health Advisory Board, we've seen no supportive correspondence from the Macomb County Health Department. I think it's reasonable for us to assume that they are not in support of the efforts of Mr. Eberly, that Mr. Eberly is counting on us as his health department to support him in this effort.
So we're Superior Health Department over Macomb County Health Department, so basically.
No,
I
we
don't
have
think that's
jurisdiction.
being said.
We have jurisdiction in this matter.
I'm asking a question, I'm wondering why is he lives in St. Clair County, but this battle, I'm concerned, it's another case with Dr. Nevin, you're gonna end up dragging the taxpayers' money into a lawsuit, because you're gonna be a part of that, and then we have to support you or provide your attorneys, and a lawsuit after lawsuit after lawsuit, let Macomb County deal with this.
So Macomb County will not provide the Eberly family the satisfactory outcome that they are
So
seeking.
we're the superheroes for the state now. All the
No.
counties that are against you.
We have an obligation to assist our residents, and Mr. Eberly has come to us as his county's health advisory
wonder
board
why-
requesting our assistance.
I wonder why the gentleman chose to go to Macomb County schools versus Port Huron or St. Clair County schools.
So
He
there
didn't
are
want us to protect him
there are
when he's not happy
instances.
with Macomb County schools.
So, Madam Chair, there are instances where an individual is resident in St. Clair County and their designated school board is outside the county.
Correct. This is a school of choice situation. However, there are multiple borderline districts.
Well, I live in a district like that, Memphis Community
Yep,
Schools, we're
correct.
split between Macomb County and
Absolutely.
St. Clair. I'm just concerned that we're always championing these issues and it's gonna cost money, lots of money. The state's not gonna sit down and lay down and let Dr. Nevin trump over them. And, you know, there are battles, we gotta choose our battles, especially when there's, okay, because the person doesn't want to follow the rules of the school, the policies, then there's other schools, the school of choice. I'm just concerned about keep following Dr. Nevin down rabbit holes where there's a lawsuit at the bottom that we may be called, and he's using us to vote to support him, and then, I mean, we're gonna be drawn into it also. The commissioners, advisory board, and Dr. Nevin, and, you know, how stable is he here in St. Clair County? How long is he gonna be here? We're gonna be left with this. And everyone needs to understand that. This is just one of many. Now, here's another one. What's gonna be next?
Thank you.
Very concerned about that. I'm a
Madam Chair.
taxpayer in St. Clair County.
Thank you.
In the interest of supporting our St. Clair County resident, I would like to make a motion we've already made that vote to approve this waiver to be written for this family. We've heard from Mr. Eberly and seen his large family of all these kids that are currently not getting an education. So I would motion to support writing a letter by Liz King in response to this, to request clarification, because I do see there's a discrepancy with the way the law has been written and the form itself. So there is no option to do a medical, or to do a waiver for just an ethical reason. So I would agree. So I motion for that.
So you're motioning for a letter from Liz.
Requesting clarification in the form of a declaratory ruling.
And Madam Chair, if I may add, for the purposes of effectiveness, the letter would be most effective if Liz could request, potentially she may need to request the assistance of counsel, but essentially what we are seeking is a declaratory ruling as to the question of whether it is the state's position that a physician, including Dr. Nevin, can issue a physician's exemption for reasons of appropriateness, period, not the medical appropriateness that the state has added on outside of statutory language. And if so, and if the state believes that a physician can issue an exemption for reasons of appropriateness, including medical ethical appropriateness, as we agreed to at the last meeting, whether this form is the appropriate form to use.
I would like to second that motion, Monica.
Is there further discussion?
Yeah. Anyone want to go first? Any other?
Ed?
No, I think we should pause on weighing in on this, and get Liz, the health officer's opinion, whether she has some questions about that.
Well, I think that's the whole point of involving legal and bringing legal into it.
Let me mention that
mention-
legal already has the exemption, the original letter that Dr. Nevin had issued, so they do not have the state's response yet. They will soon have that response, and we will await some advice from legal.
Correct.
Thank you.
So we're going to vote on it.
Right.
We're going to vote and push something forward before waiting from advice on the legal, from legal? Are we doing that?
That's included in the motion.
That's
advice
with
from legal.
advice from legal.
And I would add, Madam Chair, of course, we have to think of the broader context. There is some urgency to getting this resolved because Mr. Eberly's children are out of school. And the sooner we can all reach an agreement on this matter, I think, the better. If it may very well be that the state is looking for this to be litigated. It may very well be, Madam Chair, with response to Kevin's comments, it may very well be that the state is preparing for this to go to litigation. And I would hope that our county would support litigation of this nature in support of our authority as a health department to issue these appropriateness exemptions. But if in fact what the state is doing is throwing us a bone here, if the state is essentially acquiescing by modifying this language, then the state should acknowledge as much in the form of a declaratory ruling in response to our request. So it may very well be that this could get resolved quickly.
So we added on, like I said, being Sue happy. And I just want to mention that this gentleman, he's welcome to bring his kids to St. Clair County Schools.
But that doesn't change.
I understand that.
The
but I didn't
situation.
make that point. I get that, but I'm just concerned about, it's like Dr. Nevin's rallying lawsuits. So, for us. And,
I personally
we're
don't
gonna be
see it
dealing
like
with
that. It's parental rights is what I see it as. That's just my opinion.
Just a couple things. The time frame of all this, there has been no suits filed that I'm aware of, and you're going to have a period of discovery, which will take up to potentially 6 months. At that point, our attorney would look at this. So I do believe there's a thing of, we need to have this addressed, rather than just let it sit, because you're going to have the same thing discussed next month, and the following month, and his schools, and what Kevin likes to bring up, what if these were minority children, and we didn't take any attention to it? But I don't think that should be part of the discussion. I think every child that is brought up, or anybody, any individual in the county, needs to have the determination of our health department, the health officer and the medical officer, to take their actions to address that specific issue, whatever that issue is. We need to address that. It has been addressed so far. I do have concerns with the time frame as far as this letter, and it's addressed back to Elizabeth King. I'm not sure how that happened unless it was initiated by Elizabeth King. And I don't know if you know that, could answer that or not.
It was not initiated. That was the state's response from their conversation with the parents in the schools. But she is the health officer, so she is the director of the department.
Okay.
And
'Cause
it was sent to
looking
her
at this,
based on that. And so, no, and it just came yesterday.
Right, and
That's
everybody
night
got
after
this now,
hours.
and that's being addressed. But the timeframes from when the parent, or they have left, has addressed the school, and when this has been addressed, and then have it addressed back to Liz King without any request from Liz King, if that's your position, that Liz King never got involved with this?
No, she wouldn't have to request that. The state certainly is going to respond
Fair
to
enough.
that.
But I believe the essence, you guys, whatever you guys vote on, it needs to be addressed one way or another, otherwise you're going to keep looking at this.
100%.
Madam Chair, I do think it is important that we clarify what forms that are needed and clarify and get that information ahead of time. Maybe they'll make another revision of 126 and it'll be fine. And then it's just written. I think that's the least detrimental and the easiest path to go at this point for everybody. I mean, if they can do that over Christmas and January 2026, oh, here's the new form, we revised it for you, great.
Is there any further discussion?
Reread the motion, please.
The motion from Carolyn to have a letter from Liz with advice from legal to request clarification from the state in the form of a declarative ruling as to the question of physician issue of appropriateness.
Yes.
Good job, Monica.
Can we have a roll call vote, please?
Yes. Leanne Klink,
Yes.
Carolyn Richards, yes. Stephen Smith,
Yes.
Dawn Folk,
Yes.
Monica Standell.
Yes.
Kevin Watkins.
Yes.
Do I still have to read, Marie, or, like, okay, all right.
Okay, that motion passes 6-0.
Thank you very much. So now I'll move on to 8A.
Can you hold 1 second?
Yes.
Just going back onto the correspondence, the letter from,
Oh, yes, thank you.
Steve Gerza.
If I may, could I include that as new business? I was intending to discuss this under new business.
Okay.
Because this was a letter from me, not
Yep,
to me.
perfect.
Yeah, very good. So now we're on item 8A, Michigan BIS. I have an update. As I mentioned, I was going to speak to a senior official at CDC about this. And you should see this page in your packet. These are two separate captures from the Michigan Department of Health and Human Services Vaccine Information Statements page. You can see the website below. The first page is April 1st, 2025, and the second page is recently updated December 9th, 2025. Now, you'll notice in the highlighted sections some remarkable developments. So in April, it was the position of MDHHS that in Michigan, it is important that vaccine recipients, their parents, or their legal representatives be given the Michigan versions of the VIS. Okay, so I think a reasonable physician would interpret this as saying you must receive the Michigan version of the VIS. Now, perhaps after speaking with their legal counsel, they realized that that was not defensible. And now, I'm pleased to report that the website reads, in the state of Michigan, vaccine recipients, their parents, or their legal representatives can be presented with Michigan versions of the VIS. This is a victory. So the state has acquiesced. The state has very likely realized that this guidance that they had been issuing, that the federal versions of the VIS were not permitted, that Michigan providers must only distribute the Michigan versions of the VIS. This is, I think, been clearly shown to be incorrect. Now, this has some consequences, because you'll recall at a previous meeting I mentioned that the reason Michigan uses the Michigan-specific versions of the VIS is to avoid having to comply with the requirements of state statute, which call for all parents to be given a MICR opt-out form at the time of pediatric vaccination. That's required by law. So when you vaccinate your child with MMR, for example, you must, by Michigan law, as a parent, be given the MICR opt-out form, and you have a right to complete that form right then and there and hand it back to the doctor, and that would preclude your child's vaccinations being registered in MICR. The state clearly doesn't want that to happen. The state, never seeing a law that they allow to get in their way, decided we're simply going to ignore that law, and we're going to pretend to comply with the requirements of law by rubber stamping some boilerplate language on federal VIS, we'll call them Michigan VIS, saying if you don't agree with MICR enrollment, then you don't have to have your information enrolled. But that was not the intent of the legislature. The legislature very clearly said you will be given a form as a parent. And a VIS having no check boxes, having nothing to complete, is not a form. So I think this is a remarkable development, but this is now a call to action. We must act on this, because very clearly there are vaccine providers in our county who are not in compliance with the law. Right? The state is now implying very clearly that vaccine providers must distribute the form at the time of pediatric vaccination. So I am considering, and I'd be happy to take the advisory board's advice and counsel on this matter, I'm considering issuing some type of burst fax alert or some kind of letter to clinicians informing them of these developments, reminding them of the requirements of statute, and that when vaccinating children, parents must be given a right to opt out of MICR enrollment, and that, and reemphasizing that particularly now, given what we can reasonably expect to be a high pace of revisions to the federal VIS, right? We can expect that HHS, with its newfound emphasis on vaccine safety and informed consent, they're going to be updating many of the federal VIS to add additional information on risks and benefits and considerations for vaccinations where joint decision-making is emphasized, reminding clinicians that they should be using the most current version of the federal VIS as made available on the CDC's website. I would like to send a letter like that out to clinicians in the new year, and I'd be happy to accept the advice or counsel or recommendations of the advisory board in this regard.
Madam Chair, I do have a question. Dr. Nevin, can you, do you happen to have that law where it does state that, because I don't know if it's a new law. I mean, as a parent who did vaccinate my children,
Yeah.
I had never, ever received a form.
Yeah, that's-
to
that's-
opt
that's
To
out of
opt out of
MICR.
MICR? Yeah, neither have I.
Neither of us.
I think, obviously, MICR serves as a good purpose because a lot of parents don't keep track of
Right.
immunization
Right.
records, and MICR is that purpose. I understand confidentiality, and I understand some people wanting to opt out of MICR. I think by and far, it serves its purpose. Again, for those that can't keep track
Right.
of them, or that, I mean, I don't know why, but everybody loses the green card.
Well, so Madam Chair, and I'll refer, you may have in your files, if you've been taking home the memos that I've been distributing. On July 23rd, I distributed a memo to the advisory board. It was titled Conflicting Federal and State Guidance Regarding Vaccine Information Statements. And this discussed this ongoing controversy and so on, which has ultimately led to these changes. And I mentioned that I was requesting the involvement of our congressional delegation to help raise awareness of this at HHS. This did result in the awareness at HHS. I did receive a call, and I've been in correspondence with representatives from HHS. We now correspond quite frequently, I'm pleased to say. But this all relates to MCL 333-9206, paragraph 2. And this is a law which requires distribution of the designated MICR opt-out form to parents prior to the child receiving an immunization. Now, from a public health perspective, I think it's very important that we direct clinicians' attention to this law and that we demand compliance with this law. And I'll explain why. So, for example, we heard today from Mr. Eberly, right? Mr. Eberly is not opposed to all vaccinations, but he's very much opposed to the government having a record of these vaccinations. In his opinion, and in the opinion of many residents of our county, it's really none of the state's business what vaccines their children receive. Prior to the era of databases, we were more than capable of keeping track of polio vaccine, MMR vaccine, and so on with the old yellow cards that we all remember. And from a practical perspective, I think if parents make photocopies and backups of these records, keep them in their safety deposit box, there's really no added advantage for the parent in having their immunizations tracked in MICR. Now, the advantage of having everyone's vaccines tracked in MICR is that it gives the state control, right? It empowers the state to do what we've seen, to arbitrarily deny Eberly's children enrollment at school. It requires and empowers the state to say, well, you have to come into the health department and complete your waiver form using the MICR system. It is power that the state has been granted that ideally would not be abused, but as we've seen, the state health department has consistently abused the power granted to it through MICR. And I think in order for us to preserve what little confidence remains in vaccinations, we must recognize that many parents are turned off, very deeply disturbed by the process of vaccination being tied to compulsory database enrollment. And so I am increasing, I didn't originally believe this, but in speaking with many parents who have concerns about vaccination, I realize that one of the major impediments to their being more acceptive of vaccinations is this element of state tracking and control. And so I am now increasingly supportive of parents who wish to disenroll and opt out of MICR. And even if it wasn't the law, right? If this was optional, that parents consider disenrolling, I would certainly encourage that when the parent wishes it. But this is the law. Parents must be given a form to opt out at the time of vaccination. So I think it's very important that we remind clinicians, that we remind pharmacies of this, that we remind pediatricians' offices, that we remind urgent care centers and hospitals that they must give this form. They must physically hand the form to the parent and not take it back unless it's been filled out. And I think in the new year, it would probably be a very good development for us to send a reminder of that out to clinicians in our county.
I don't think there's anything wrong with you putting out a letter or a thing advising and reminding folks of that.
Right, it's nothing new.
Right, it's nothing new, it's a reminder of what, I mean, that's just my opinion. I mean, I just, yeah.
I agree.
I would agree as the medical director.
I asked Dr. Nevin, do you routinely meet with the physicians and being the medical director of the physicians in St. Clair County? You guys meet or have some type of forum?
So
where you discuss these things?
So in St. Clair County, we have a very robust medical society, far more robust than in many of the other states where I've resided and am licensed in. Of course, you know, my available time precludes me from being as actively involved in that as possible. Perhaps if I had more time with the county health department, I would be able to spend more time with them. But that being said, I'm confident that our county's clinicians would want to comply with state law and would welcome clarification of what these legal requirements are. I don't anticipate any opposition to complying with the law by our county's clinicians.
I was just wondering, had you had any? And also with the local dentists, since you did issue memorandum in regards to fluoride, do you meet with them? Any feedback from them?
Well, when you say meet with the dentists, there's only so much dental work that I personally require, right? So I try to stay out of the dentist's office as much as possible. Look, if it's the desire of the advisory board that I take time out of the 16 hours a week that I'm allotted to visit with dentists and personally discuss these developments with them, I'd be more than happy to do that. But, you know, my available time precludes me from doing that amidst competing priorities.
I believe that their time would be probably not allow as well.
No.
Considering their busy schedules.
I disagree. When there's recommendations, highly recommendation from the medical office stating that they should be doing certain things. I
Following the
think-
law?
No, I'm talking
Following
about
the law.
fluoride.
That's all this is talking about, and he was just relaying information with the fluoride, with the changes from FDA on those fluoride gummies. That is all. He was relaying information.
I beg the difference more than relaying information. It's more stating that this is what you should be doing, or between the lines, maybe another lawsuit.
Okay.
No, so moving along, I'm happy to move along to agenda item C if there's no further questions. I recognize the time. So we tabled a discussion of the medical examiner's annual report. A medical examiner is not part of the health department. In some counties they are, but in our county they're not. They produce this very, very nice report. Now, in speaking with some of our staff, my understanding is that not all the deaths in our county become subject to medical examiner review. There are instances where I believe other counties' medical examiners will review the deaths. Like, for example, let's say you're on vacation in a different county. I don't think our county medical examiner is going to be made aware of your death in a different county. But that being said, there's no reason to think that there's any significant bias in this analysis. So I think we can say, to a reasonable degree of approximation, this is a fairly good representation of patterns of death in our county, right? And as I mentioned before, big picture, 160,000 people in our county. Every day, tragically, we have about 4 to 5 deaths in our county, and we have 3 to 4 births. So on average, we're losing about 1 resident a day net, you know, due to demographic shifts. I don't see anything particularly surprising in these figures. I think these results undermine, and we'll discuss this in new business, undermine some of the state's arguments, for example, that guns are a terrible risk and a terrible public health problem. In our county, there's really no evidence of this. Firearms deaths are largely a urban concern, not a rural concern. But even things like accidental deaths and drug-related deaths, while we want to reduce this, we are certainly not an outlier in any respect. And I don't see any significant cause for urgent action with these data. But I'm happy to entertain questions and consider other positions as the board may suggest.
Anybody have anything? Okay, let's move on to new business.
Okay, very good. So why don't we discuss the letter
Yeah.
that I sent to Professor Gura. So I've appreciated Professor Gura's comments to our board. He spoke in favor of my position on the outlying clinics, you may recall, taking my position in that. And I found him to always offer wise counsel in his former role as a member of the Advisory Board of Health. And I was somewhat surprised to receive this letter from him. He asked me in an email for my opinion on whether SC4 should continue with its policy of mandatory flu and coronavirus vaccination for their clinical staff. Now the context of this request is this is not something that they are entirely in control of, because the mandate which they have imposed is somewhat informed by separate requirements of their clinical locations, right? So if they send out nursing students to a certain hospital, the hospital itself may impose requirements, right? The hospital itself may say, well, you need to have the flu shot, or you need to have the coronavirus vaccine. Now, as an example, our department, as you may be aware, no longer requires the coronavirus vaccine for its clinical staff. And at my recommendation last year, I believe, discontinued its requirement for an annual flu vaccine among clinical staff. And not surprisingly, because many people will willingly agree to get the flu shot, I believe 85% of our clinical staff nonetheless received a flu shot this year. I received a flu shot this year, for those who are wondering. Not a coronavirus shot, but I did receive a flu shot. So many healthcare providers will just naturally get vaccines if they believe they're safe and effective and appropriate. And I have little doubt that the students at SC4 would do the same. But the question is, should it be mandatory? Should it be compulsory? And in this letter, you can see that I articulate the reasons why I believe that compulsory vaccination is not appropriate. And high among them is that the argument for the compulsory nature doesn't apply, right? The rationale for government's compelling vaccination has typically been made on third-party grounds, meaning your vaccination can stop transmission and can potentially preclude someone else from getting sick. The earliest vaccines, smallpox, MMR, and so on, that provide robust mucosal immunity, a different kind of immunity than the modern protein-based vaccines, there is a rationale. And Supreme Court precedents that have defended compulsory vaccinations have cited the transmission blocking or altruistic or third-party benefits of vaccination. There is no similar benefit with the influenza vaccine or the coronavirus vaccine. We all recall being told, if you don't get vaccinated, grandma's going to die, and you should get vaccinated to help your community out. We know now this is a bunch of bunk, right? We knew at the time that they knew this was not true. And this was just the preferred messaging to encourage vaccination. The government officials and drug company representatives were intentionally lying. We know this now. About the third-party benefit of the coronavirus vaccines. And similar reasoning applies to the flu vaccine. You'll hear people say occasionally, well, there's some studies that show a decrease in transmission. There's no reliable, compelling evidence that's strongly valid based on traditional scientific grounds for any third-party benefit to either the coronavirus or influenza vaccines. They really only benefit the individual. And FDA admits as much, right? Because these vaccines are not licensed for their transmission blocking potential. They're not licensed for the indication of preventing onwards infection. They're licensed for the individual benefits they provide. And so if this were to ever go to court, if this ever were to make it to the Supreme Court, and I suspect in due course it very well might, the Supreme Court is very likely to say, well, look, you may be able to legally compel vaccines with third-party benefit, but not vaccines like the tetanus shot that only help you. And so it becomes a matter of medical judgment what vaccines do and do not have third-party benefit. In my professional medical opinion, as supported by folks at FDA and elsewhere, these shots don't have third-party benefit. We can't reliably say this. And so as medical director of St. Clair County, I advised him, I just don't see the public health rationale to mandating this. This is a personal matter between the individual students and their doctors. It's a personal matter between them. Now, Professor Gura said he's going to take this letter and circulate it and socialize it within the organization, and consider potentially sharing this with some of the outlying sites to see if it's possible for them to relax their requirements. But this made me realize that there may be value, and we can table a discussion of this perhaps to a future meeting, but this is a matter where we as a local health department do have some authority, right? We can direct policy in this regard. We have the authority under public health regulations to state, for example, for public health reasons, in particular in order to preserve public trust in public health institutions and public health and vaccinations, that there is a compelling public health argument to not permitting compelled vaccination. And we probably could, we would have to discuss this with legal counsel, but we could, for example, declare St. Clair County and the clinical sites that SC4 students predominantly learn at. We could, for example, declare St. Clair County a vaccine choice sanctuary county and prohibit or restrict through regulation the power of individual clinical sites and schools to require vaccinations of this nature for their clinical students. This is something that we have the power to implement, and I'm happy to consider something like this at the advisory board's discretion at some point in the future. We could probably table this.
Can I weigh into this? We're getting to the point of craziness now. I repeat myself, craziness. Because Dr. Nevin, think what you do, you're speaking on both sides of your mouth, sir. One, you say we must never have mandates. Now you're imposing on the county. Commissioners are going to drag them to another rabbit hole, mandate now that the hospitals, that the nursing college, all the health sciences, say we are vaccine-free, county. What happens?
Madam Chair,
No, I'm not done with Dr. Nevin. No, please, let me, please. We did have a health board flu here, one meeting, where we couldn't get very important business done. And I'm assuming they were sick. They would just not show up when they're appointed to do something very important. Now, what happens if all the professors get the flu, and now we can't have, the students can't get educated? Or the students get sick, they can't come to class, they can't graduate. You see the road you're going down? You see the road is going down? Everything is that we're going to put it amongst our commissioners to mandate all these things that he wants to do, to stop things moving forward with, now he's on the flu shot. What is next? I just ask you this. Where was your fight? Were you in a fight against preventing smoking in public places? Because it was mandated, you cannot walk in a restaurant with smoking. So that was a mandate. So were you against that?
So Madam Chair, if the member's asking me a question, I'm happy to bring this up at a future meeting. I think you're asking me for what my priorities are, what my philosophy on various established doctrinal orthodox public health positions are, right? In Michigan, currently, as of today, I believe only 21% of our population has received this year's flu vaccine. So, Madam Chair, I would ask the member, what is the majority position on whether one should receive a flu shot? Very clearly, 80% of the public says maybe not. As of today, I believe only 8% of Michigan residents have received this year's coronavirus vaccine. Assuming our population is relatively evenly divided, 50% red, 50% blue, and assuming most of those vaccines were taken up by the blue side, that would mean even an overwhelming majority of the blue side did not take this year's coronavirus vaccine. The public has very clearly spoken that they have profound doubts about the near religious zeal with which our public health officials mandate and demand that the public acquiesce to their recommendations. The public is not having it. The public is soundly rejecting these recommendations. And for our profession to continue to have relevance, in order for the public to trust us when that trust is important, we must acknowledge that we are increasingly appearing tone deaf to the desires and will of the people. Look, with regards to the flu vaccine, the reason why many people don't get the flu vaccine is it's frankly not a very good vaccine. The efficacy of the flu vaccine, in some cases, is calculated to be negative. At best this year, the very best forecasts call for this year's flu vaccine, because of the mismatch, which you may be familiar with, the H3N2, they locked in a subclade J, which they thought would be the predominant subclade this year. But as flu viruses tend to do, they drift quite quickly, and so there's a new subclade K, which is spreading. It's probably going to result in a significant burden of flu vaccine this year, and our flu vaccine is virtually ineffective against this. At best, we may see 20–30% effectiveness. So with the very low prevalence of flu vaccine, flu virus in a typical year, maybe you have a 10% chance of getting the flu. And with the low effectiveness of the vaccine, the number of individuals you need to vaccinate with flu vaccine in order to prevent a single infection is on the order of 15, 20, 25. And so the average individual going in to get a flu shot, they have to take time off work, they have to go into the drugstore, they have to roll up their sleeve, they have to sit there and get that painful shot in the arm, they bleed a little bit, sometimes it stains their shirt, they hurt for a day or two. And at best, there's maybe a 5% chance that that vaccine will do any good for the individual, right? So many individuals, even if they can't calculate the benefit the way I have just articulated, they understand at some intuitive level that, this is probably not going to do much good. And if I get sick with flu, I can just go to the doctor and I can get some Tamiflu, and that's much more effective, right? So many people make the rational decision not to get the vaccine. Now, this is a decision that people should make with their doctor. There are many individuals for whom that benefit, that calculation that I just described, actually weighs more in favor of getting vaccinated. But for example, a healthy 20-year-old man, it may not be necessarily the appropriate choice for them in that particular context. And regardless of what we say about this, regardless of what state officials say about this, the public very clearly is not going to be convinced otherwise, right? As of today, only about 20% of Michigan residents got the flu shot. Are they wrong? Are the 80% that didn't get the flu shot, are they just misinformed? Are they confused? Do they need mandatory re-education? Should we force them to get the flu shot? Or maybe the state officials who have been mandating that a certain percent of people get the flu shot, and that regardless of their personal preferences, they be shamed into getting the flu shot, maybe they're the ones that are wrong.
Madam Chair, may I say something?
You may.
Thank you. So, per our bylaws, Article 2A2, it states, to enhance the governmental presence locally in assuring that conditions in which people can be healthy and recognizing that persons have a right to make a health decision about one's body and one's self, subject to established law. To that end, all actions of the St. Clair County Health Department Advisory Board of Health shall strive to ensure that our citizens and their children maintain their inviolate right to medical decision autonomy and self-determination of their own body and their children's, to recommend policy for the St. Clair County Health Department. So I believe in our bylaws, it states we have to, comply with body autonomy. I know McLaren Port Huron Hospital does not require the coronavirus vaccine nor the flu shot, and the waiver is very available, and that's really all we have to do is sign a waiver. It's a one-time waiver, and that exempts us as long as we see fit, because it is our bodily autonomy. I don't know of the other hospitals' positions. I would say maybe individualize if some organization comes to you for, just as you did with SD4, individualize it and, write your response. But I think that's definitely bodily autonomy.
Mr. Rushing.
Yeah, it's very narrow. I think it's been far too much discussion on this. You got business to take care of.
Yeah.
This letter is asking SC4 to follow the guidelines that we have at our health department and Dr. Nevin also said this could be tabled and be addressed later. But if this was to become forward to the St. Clair County Board of Commissioners, my own position would definitely have to support something like this. But I'd have to see the specifics at that time. But way too much discussion over, just would you follow what we're doing at the St. Clair County Health Department to the employees at SC4? So,
Thank you.
Well, one more thing, Madam Chair. Mr. Rush, you think it's way too much discussion. I don't. Well, I'm saying one thing, keep in mind, it's probably never crossed your mind. It should, Ms. Richards and others, and Dr. Nevin, that our nurses, for one, I work in health sciences, and I will have some weigh-in on this with Mr. Gura. You need to understand something. Our clinical students at the hospitals, they only can miss a certain amount of clinicals or they fail. You can't miss 5, 6 days of clinical because you have the flu. There's a reason for everything. So keep in mind, let the public weigh in, let the public weigh in, are they gonna, what are they gonna say to those students when they fail and have to come back next year or not complete it all because they could not come to clinical because they obtained, got sick, the flu, and you're not there, you don't pass. So when you make these decisions, keep that in mind, please. That you're talking about the public, but let's talk about the students and what they need to do. What is mandated by the nursing department, you must meet so much clinical hours to pass.
Right.
You cannot miss 6 days out of 12.
So, Madam Chair, I recognize his concerns, but the issue is that this, if what you want is you want some sort of magic wand that will keep people healthy and keep them from acquiring the flu, this year's vaccine is not it. This year's vaccine is relatively ineffective. And as I mentioned before, you probably have to give this vaccine to about 20 people in order for it to have any meaningful action in just one person. So for folks at SC4 that, are at risk of contracting a respiratory infection, they should have their doctor's number, in their cell phone. If they start to develop symptoms of flu, they may wish to go see their doctor. They could be tested for influenza. There are effective medications that are available that can interrupt the clinical illness of flu, cut a couple days off your illness. This year's vaccine is not the panacea that it has been advertised as being. We may very well get a very bad flu season this year, fundamentally because the flu vaccines aren't as effective as they have been advertised. Current flu vaccines are not the solution to flu. They are a very crude and ineffective instrument. They may be described as the best thing we have, but we obviously need better. The public is voting with their feet and saying, it's just not worth it. Thank you very much.
So if I could sum this up, it's personal choice. And to your point on nursing students, if they know that they can't miss clinical time, then that should be a priority to them to get the flu shot. That's a personal choice. So, your program may mandate it, and that's fine. I'm not getting in the business of SC4 and their mandate, but all of this comes down to personal choice. And so, let us move on.
Freedom.
Thank you.
Freedom.
Okay.
All right. I have one more item, and then I'll be done my update. So I included in your packet this news release from MDHHS. Now, keep in mind, this is the State Health Department, right? And they have organized a gun violence prevention task force, and they make a series of recommendations, which I think to many of our county residents come across as very obviously and blatantly partisan. These positions are indistinguishable from many Democrat talking points, right? These very clearly are not positions that your typical Republican in the State House would take, but these perhaps coincidentally align perfectly with the legislative agenda of the Democrat Party. Now, public health officials in our state wonder why nobody takes their advice, why almost all Republicans and an increasing fraction of Democrats don't take public health officials' advice on things like flu vaccination and coronavirus vaccination. Maybe because, not unreasonably, many members of the public correctly view state public health actions as being motivated primarily by radical partisan concerns. And the misuse of public health to pursue what are very obviously and transparently radical partisan agenda items undermines trust in public health. I don't want there to be any confusion among members of St. Clair County's population that we in any way, as a matter of official policy here at the St. Clair County Health Department, in any way endorse any of these recommendations. This is not public health. This is radical partisan politics masquerading as public health and being forced on an unwilling public through administrative mechanisms. I think that releases like this harm public health and undermine the good work that we do by resulting in a net loss of trust in public health organizations. And so I think there may be value to us as an advisory board and us as a health department strongly pushing back against these positions, disavowing these positions, and clearly articulating the opposing correct point of view that widespread responsible firearms ownership is in fact a net public good that results in numerous benefits to a community.
Madam Chair?
Yes.
So is it not true, or Dr. Nevin, that these recommendations come from failed legislation, correct? They couldn't get passed.
Yes, that's correct.
So now they're trying to use the health department to get this, would you say embedded into the health department?
Yeah, that's correct. So as we've seen, we saw an example of this with the MICR law, right, and the VIS interpretation. When our state agencies, when the deep state, when the Michigan deep state, the entrenched Michigan deep state, cannot get its way through the democratic legislative process, they then use their entrenched power within the agencies to advance the exact same deeply partisan agenda. And this is an example of this. All of these proposals have been rejected by the legislature. And in fact, you'll see on the first page, increase the eligible age of firearms purchases to 21. There is a bill which has been presented in the State House, which undoes the restrictions, the age restrictions on firearms ownership, which reduces it back down to 18. And so here, from a public health, from a notional public health perspective, you have paid state agency staff who are supposed to be nonpartisan, who are directly advocating against a position which is being advocated for by a duly elected member of the House, right? This is very clearly partisan abuse. And when our state public health officials wonder why only 8% of Michiganders are following their advice and getting the coronavirus vaccine, they need to look no further than this, because by embedding radical partisan ideology into public health agencies' core activities, they alienate the public, and it results in a net loss of trust. You're absolutely right. None of these proposals would ever pass the Michigan legislature. But not being content with our democratic processes, the Michigan deep state is intent on abusing its agency authority to achieve the same ends.
Madam Chair, Dr. Nevin, I don't think you realize what you're doing here. You're actually the frying pan telling the skillet you're hot. You're talking about partisan politics, and you are extremely partisan. I mean, extremely partisan. The deep state, anything that the other side does is okay. This crazy stuff that Tylenol is poison. You know, we can go on and on about that. Vaccines cause autism. Now you find out it doesn't, you're quiet. So I take offense that you keep bringing this to this table, to this health board, about these partisan things, attacking one side or another. You should be nonpartisan, being the medical director here of St. Clair County. They're not just Republicans in this county. There are Democrats here too. Do you represent them also? You're so partisan that I don't think you do. And it's very discouraging.
Well, thank you, Madam Chair. So I will say that what is needed in public health is balance. If you were to poll the 45 local health departments, what do you think the partisan representation of their medical directors would be? Would it be representative of Michigan's population? Would there be 20 medical directors who are Republican and 20 medical directors who are Democratic? Or would the overwhelming majority of physicians in public health in Michigan be not just Democrat, but radically Democrat?
How do you know that?
Well, so we can look at public records of political donations. We can look at the type of positions that they take and see whether they comport with Democrat or Republican policies. I think it's a reasonable assumption to make that Michigan Public Health has, for many decades, represented not just the middle ground, as you suggest is appropriate, but a radical partisan perspective. And what I propose is that we reintroduce some balance, right? It should be okay to be a conservative, to be a populist, to be a Republican, and be in public health. It should be okay to support MAHA. It should be okay to support the new recommendations of the Centers for Disease Control Advisory Committee on Immunization Practices. It should be okay to say many of the things that RFK Jr. is doing are good and long overdue. And yet, if you ask almost anyone else but me in the Michigan public health community, they will say almost to a person, absolutely not. It's apostasy, it's heresy to support anything that side does. And I think it's largely driven, I think we need to be honest with ourselves, it's largely driven by partisan animus. It's largely driven by Orange Man bad. Anything that he is in any way affiliated with is bad. This explains the radical opposition to MAHA by state officials, and it explains many of the recent public statements by state officials. They are adopting a very obviously partisan position in opposition to the changes that are occurring in D.C. But the public has very clearly spoken. The public overwhelmingly supports MAHA. RFK Jr. is the most popular member of Trump's cabinet. He has a majority of support across the population. So am I proposing things from a public health perspective that are novel or unusual? Well, yes, but that's only because public health has been so completely captured by radical partisan interests that my centrist position looks radical in comparison.
Madam Chair, I would like to make a motion, please,
Okay.
that we table any further discussion regarding gun violence memos or memorandums until a later date, please.
Support.
Been moved and seconded to table any discussion, further discussion on gun violence slash.
It could be gun violence memorandums
Okay,
or mandates, however you want to write that. That would be just further discussion period. You could even just put that.
okay. Any further discussion? All the, yes?
Because wherever you go with this, I think it should be ignored, the entirety of it. This is potentially for the medical, it's got assault weapons in there. Who the heck can define an assault weapon without going through this bit by bit?
Yeah.
But the important part, I guess, is that the health department has no resources to actually enforce anything they potentially would put in place. That would be done by the sheriff, and the sheriff is already going to uphold the Second Amendment of the U.S. Constitution, as he said he would, and also we have a resolution in St. Clair County supporting the Second Amendment. And this, if Lansing comes up with something in legislation, well, definitely you follow the law. But anything that the health department, Lansing or here, comes up with, there's no way to enforce any of this. You can't, so.
Thank you.
Thank you. It doesn't stop MDHSS from trying.
Right.
Correct.
Okay.
Yeah. and
It's been
Madam Chair,
moved and seconded.
No more discussion. Out of my discussion is so that the audience, and especially the advisory board and the commissioner sitting in the advisory board, would just be mindful of the pattern of what Dr. Nevin is doing in regards to the challenges against what things, and that how that would affect the county and how it would affect us in our pocketbooks also, lawsuits.
Thank you. Any further discussion? Bless you. All those in favor, say aye.
Aye.
Opposed? Okay, that motion passes. All right, health officer update. Do you have anything from,
Yes, I have one simple thing. It's the closing the door on the Yale Clinic. Liz did have discussions with Great Lakes Bay, QHC. They were not interested in pursuing Yale with us, or for us, or on behalf of us. We had multiple discussions with Community First through the Algonac process, and they have no capacity or interest in doing that right now either. So this department no longer has any influence on this. Grant money is terminated to this department, so any future clinics at Yale would be at the discretion of the state and the Yale School District. So we are in the process of dismantling the clinics out there per the request of Kurt Sutton, the superintendent. That'll take a couple weeks or so, but yeah, we're gonna bring back the furniture and partitions and walls and stuff back to this department for storage at this time.
thank you.
Craig, I got a question
Yeah.
for you. Why wasn't Great Lakes Bay interested?
I'm not sure. Liz had a discussion with them. I don't know if it was a capacity issue or, I really don't know, but we could have a discussion with Liz on what their reasoning was.
Okay. Local providers aren't able to or not willing, they spoke to local
No, it's-
providers in Yale?
Yeah, it's financial. I mean, without, you know, the providers really aren't able to even apply for the grant. So, as an individual, and I don't know why they would, I guess, but.
Okay.
Madam Chair, if I could follow up on this, because I think these developments only reinforce the rationale that I had presented. If Great Lakes Bay, with all of their resources, with their dozens and dozens of clinical staff, presumably their excess staff, and with all of their financial resources, can't operate the Yale Clinic, if Community First, which did accept the Algonac Clinic, cannot operate the Yale Clinic, again, with multiple full-time clinical staff at each location, then is it possible that we can accept that our medical director, who assessed the operations at that location and determined, based on my medical judgment, that we could similarly not operate that clinic and preserve the standard of care? Is it perhaps not possible to admit that I was correct?
I disagree
Well,
vehemently.
Thank you.
I need to speak on that, Madam Chair. Am
I think this is a done issue.
I need to respond
And I
to
think that
the-
when we continue to keep, it is not healthy. It's a done.
Okay, you allowed Dr. Nevin to speak on and on and on, but you
It's
don't allow the
done.
Health Advisory Board.
No.
I had a question for
We're
the
moving
Health
on.
Department.
We're moving on. And items from members.
I just had one more question for Greg. I'm sorry. Greg, what is this expanding, enhancing, and emotional E3 health centers in KPEC Elementary? Could you speak on that?
Yeah, E3 is a grant for mental health services, and we do have funding for that, and we do have a provider in Yale, or not Yale, excuse me,
KPEC.
it's on my mind, KPAC.
Is this a new service?
No,
KPEC?
this has been
No,
going
it's
on
been
for a number of years.
Okay.
Prior to the
Yeah.
adolescent health clinics, actually.
Okay, so they have a place there in the element, okay, okay.
Algonac also had one. Or do they still?
Algonac does not on our behalf, no.
Okay.
Actually, the Algonac provider moved to KPAC,
Okay.
and now it's up to Community First, because that, E3 is separate from the adolescent
Right.
health centers. So there's funding for mental health in the adolescent health center funding, so that would be up to Community First to provide that.
Thank you.
Yep.
Amy, how did the teen open house go? Teen Health Center open house? Good. Good. Awesome. Thank
Yeah,
you.
we had a couple of commissioners showed up. I think it was Commissioner Beeden and Commissioner Andrews showed up.
At the
They were
team?
there when I was there, yeah.
Okay.
I'm not sure if Commissioner Rushing showed up or not. I was there the whole time. You would have to tell us.
Is there anything else from the members?
Yep, I can start on this end, since we started on that end last time. First, I I just state that, the disappointment, not just in me and many, how we abandon our rural community. We're kind of a balanced sector, kind of rural and urban. We just outright abandon our rural community. I'm in the rural community in Wells Township. That Dr. Nevin, it's interesting, he speaks for Community First and Blue Water Lakes. He seems to know why they did not take the clinic. Why is he speaking for them? We don't know why they refused to take the clinic. What we do know is that Dr. Nevin has abandoned those patients, those students in Yale. I'm sure he's not welcome in Yale for that. I'm wondering too, with all these mandates, this hasn't come up yet, but this will come up. I guess now the parents will be able to say, my kids will have to go to school, so truancy is no longer. You can't require students to go to school. Can we talk about if a parent's their choice? I choose my students not to go to school or get homeschooled. So I wonder how we're going to deal with that. That hasn't come up, probably thought of, but that's the next. The whole vaccine thing I was so disappointed about is that I already see where we're going. It's going to take some time. And like I said, it's not until the kids start dying that we'll take this serious. That everything about, choice, yes, but you, for example, using smoking, you don't have the choice to smoke in front of me. You give me indirect, nicotine, smoke that can cause lung cancer. Dr. Nevin didn't respond to that when I asked him, were you against the mandate? You cannot walk into a restaurant puffing on a cigarette. It's against the law. Okay, sex education thing is next. I guess we're going to go back to wanting our kids to think that the babies are going to come to their window with a stork. Everything's negative. We don't want to educate them. The whole religious freedom is another issue. The issue with combining the health officer and the medical director is going to be a problem if the commissioners bring that back up. There was a massive people showing up pushing to divide those positions. And the commissioners did that. And to now to come up with a suggestion to bring them back together, we know what that is, to get rid of Liz, let Dr. Nevin have all the power. It seems they already have enough. So I'm waiting for that. I'm waiting for that they dare try to do that. After taking all that effort to separate the positions, I need rationale why you're going to do that. This is interesting, and I'm very careful with this because I have more white friends than black friends. And I know some of the things I say may make my white friends uncomfortable, but some things have to be said. This is, even black people, we can't even, I'm speaking for black people, we can't even own bad things. The hand washing issue was our issue that affected us in a bad way, and you indirectly. But here come my white brothers and sisters stepping up, talking about, oh, what about us? Everything, we weren't, why do you have to say, well, me too? Same thing with Black Lives Matter. People, oh, white lives matter, blue lives matter. I didn't say your life didn't matter. I didn't say white life doesn't matter. I didn't say blue lives didn't matter. I said black lives matter. We're the ones who died in the street during that time. But what the problem is, you got to see yourself first. You can't just, you couldn't even see when I said black lives matter, I was talking about black people, what's happening to us. You took it personal. Well, what about us? Same thing with the hand washing. I find that's comical. We can't even own bad things. Please. It's just, and I'm speaking from a person, generations, of dealing with this sort of thing. My time served on this health board has been disappointing in the fact that all these negative things are happening. We're going backwards, backwards, backwards. And I see that everyone, we know the 4-2 vote. We know the numbers here. And then there's partisanship on this board, by far. Dr. Nevin saying that talking about Democrats and the different policies, whatever, and it's totally partisan 100% on the Republican side and drawing others with him. And these are the policies and things that we're supporting. The issue I'm concerned about is that the lawsuits are going to come and Dr. Nevin's going to be gone, and we're going to be stuck with it. We keep going down one rabbit hole after another rabbit hole after another rabbit hole, all in the name of mandates. But you want to mandate, you want to fight against mandates, but want the commissioners to mandate hospitals, doctors' offices, your community members, what they can do. You're speaking out of both sides of your mouth. The skillet calling the frying pan hot. You're both hot. This is ridiculous. And the big thing for me is the whole thing with the, I'm laughing to a point. You look at the recent research, I'm sure it was sent to you, I sent it to you, in regards to fluoride. That's what everyone wants to talk about. He cherry picks research all the time. Others on this board cherry pick research all the time. But you haven't mentioned all about that the new research coming out now is proving you're dead wrong. You're dead wrong on the fluoride issue. And it's very frustrating. That's the whole thing with the partisanship. Dr. Nevin's only speaking on things and using his PhD level, speaks out and runs on and on and on in regards of these different issues. Now, I haven't heard anything about the whole autism thing anymore, vaccines and autism. Now that's quiet now because it's proven that it has been proven that that's untrue. But the part that's killing me is the Tylenol. Now Tylenol is poison. I haven't heard much mention of that. Basically, I guess they want to run away from that. But that's nonsense. Total nonsense telling pregnant women, don't take Tylenol until you have a tip of 103, because Tylenol is dangerous to you. No, the tip of 103 is dangerous to you. This is the ridiculous stuff. Dr. Nevin is a brilliant man. He's great on environmental issues, but he couldn't walk in my room as a medical doctor with this kind of mindset. That's not healthy. Not healthy to our community. But mostly I'm disappointed in is I consider it malpractice, abandoning them students in the rural communities. That Yale clinic, that money, there was money given, paid for that clinic. And we sent it back and told the students, too bad. You can't say it cost us, then cost us a dime. The money was given to us for the clinic. The school district put money in. The clinic there has been operating. Dr. Nevin shows up, he wants to close them all. He doesn't believe in health screenings. He doesn't want the health department going out to events to screen people. Here's things that we don't tell them. Well, they can't afford health care, so don't tell them they're sick. So don't screen them. That is nonsense, that's malpractice. And I'm so disappointed with that. And I'm very disappointed this health board just ride that wave with Dr. Nevin on all these different issues. One after another after another. That's why there's going to be a big fight for seats that's coming up on this board. I wonder why that the county opened up after the application process was closed, opened it back up for other people who I know are those who are on that side, the MAGA side that's going to follow Dr. Nevin to be able to apply because they missed the deadline. All this nonsense, that's illegal. So they had to reopen it because they know they illegally allowed them to submit their application. These things are going on in this county that's ridiculous. It's all coming together. And it's so disappointing, but it affects me too because I'm living in this county since 2000. And I work as a professor at the school. These issues that we're talking about, trying to say they don't need to be vaccinated, the staff doesn't need to be vaccinated. Dr. Nevin come up with his one side of the story with vaccines. Coming up, we could take this vaccine with protein-based, but not giving us any information on that. And we got people here that's going to follow down that rabbit hole. So, it's just very disappointing. And I don't know what else to say.
Thank you.
Just some good news.
Okay.
At our last board meeting with the help of the Health Department with the Smiles on Wheels, that $80,000 contract did get approved, so it's going forward. We do have an opt-in and an opt-out. That's including that because they're subcontracted with the county, so we can do that. The state mandates that every child get the health exam, and this will definitely get parents involved, every single one. Parents involved with their children, whether they opt in to get the oral exam or opt out. And what that'll also allow, and I'll be talking with Liz King as time goes through here, and then we'll be able to document and see what kind of return on the taxpayer dollars that are actually being spent for the Smiles on Wheels. So I think that was positive, and it did pass the board at our last board meeting.
Thank you. Leah? Yes, I would like to address one of the statements Kevin made regarding the SC4 statement. That was not, you are not to get mandated or anything. It was just saying that's a personal choice. So that is a slight mischaracterization of what Dr. Nevin or Dr. Gurrow or Professor Gurrow were saying. I do want to clarify that. And I do thank you, Greg, for clarifying regarding Liz in the Great Lakes Bay. I had spoken with her, and she said that it looked like they were going to close that door completely. So thank you for clarifying that. I really appreciate that. That just kind of clarifies just openly and publicly, and I appreciate Liz's effort in that. And as far as mandating and homeschooling, Kevin, I know that that's a concern. That has always been in the state, that you can choose to leave the public schools or stay in private schools. I don't think that's anything the health board is planning on addressing, because that doesn't have to do with health, it deals with school. So, that's it. Thank you.
All right, as far as Ms. Tannehill, like when she expressed her concerns, and my concerns as well, with the Michigan Department of Education, they have actually circumvented legislative authority, as well as public comments of parents, and they're circumventing, bless you, parent discretion in what their children are being taught. This is not a simple how babies are made. This is, bless you, radical, extreme education of 12-year-olds, 11 and 12-year-olds at how do they identify and who do you want to have sex with? These are the questions they're asking, and this is what they're going to be teaching within that education. So I do agree with Ms. Tannehill we need to notify. I had sent some correspondence to our Board of Education, just letting them know what is being put through with the Michigan Department of Education, because it will go back to the local school boards. So I agree that it does pose a public health, mental health concern for these children, that we need to educate our school boards and letting them know what the Michigan Department of Education is intending them on teaching, inclusive of all of those things that are stated in that 75-page document. So I feel like we should maybe look at that in the coming months, for sure. I do want to also make note of, in my time on the board this past year, I have seen multiple things that Ms. King has done to try to push back against the medical director's memorandums, recommendations. We asked her to work collaboratively or to, together. She's gone behind Dr. Nevin and the board's back in hiring or attempting to hire another physician to run those clinics. The email just to certain people requesting to pause the health department when it's in the law that we have to have a health advisory board. There's just been a lot of things that have been done for lack of, I think there's a breakdown of trust. Previously, I am aware, I know Marie Muller has sat on this board for a long time, and she had made a statement way back earlier this year, and she said, before Dr. Nevin, we really never met the doctor, the medical director. And the board probably met for, it was very minimal. It wasn't 2, 3, 4-hour meetings, public attendance in the past. So there was really no board oversight in the past, true board input. So things have definitely changed, in the function of the Health Advisory Board and the structure. So I just want to make that statement that I do have there's a little bit of a breakdown in trust, I think, with the health officer at this time with the board. I'm done. Steve?
So that was to my speaking point today, was our current structure, and I'd like conversation with the board today to decide whether to stick with this structure or perhaps combined positions. I think we all know over the last several months what's gotten us to this point. Emails. When that was sent, as a board, I felt like I didn't have a chance to fill out a confidential goals and what I could improve on. I was just, pretty much my position asked to be terminated or put on hold. So I would just open up conversation to the Advisory Board of Health today regarding the direction and structure and where we want to go from here.
So for me, the worm started turning back in July when Dr. Nevin wasn't at that meeting. And we had Mr. Felix, and it was just, I went back too. I was up early this morning going through my old notes about things because we weren't fortunate enough to have the video, which is very nice to go back to refresh a memory. But I was going through my notes and for one thing, I want to say that we didn't know, maybe Monica and maybe Kevin, just because Kevin is close with Liz, he's on several boards with Liz, but it just came out of nowhere, the clinic, the CAHC clinics. I mean, it came out of nowhere, nowhere in my notes, and I take pretty thorough notes. Nowhere in my notes did I see anything. It was like this big elephant or this big train just hit us, boom. And we had all these angry people. We had to have a special meeting on August the 14th. And we had all these angry people, angry about the fluoride, angry about the closing of the clinics, which I had no knowledge. I sat here as vice chair for the last 2 years. I had no knowledge about this. And I just feel like, we were just blindsided as a board. Way too. I mean, I didn't know about it. Maybe I was sleeping and taking notes. I don't know, but I don't think so. So then we had all these angry people yelling about, and rightfully so, they were rightfully angry. We didn't know what the heck was going on, but just upset about, the closure of the clinics and that. And I'm grateful that we've had this time these last few months, to go through and to learn about all this, about the CHC clinics, about Yale, just to learn, to dig into this, to dig into all this health department information and talk to people. So I'm grateful for that. I'm glad that we didn't make any rash decisions. I'm disappointed that we can't get, Great Lakes Bay. There's also Aspire and McKenzie too, who could maybe help out. I don't know if she's reached out to them, but and I just feel like we were just blindsided. We had all these people showing up to the meetings, and I don't believe they just showed up just because they happened to do what, I do or my friends do, and we go and look at an agenda before a meeting to see what's coming up, right? I mean, we had these rooms packed. So to me, it clearly indicated that there was a concentrated, people were talked about, they've gotten emails. So I just got the email this morning, and I wanted to come say something today. Several people mentioned that during the meetings. Like I said, I just felt like we were just blindsided. We didn't know what the heck was going on when it first happened. I did not know what was going on. And I don't remember us talking about, dates or any of that stuff coming up, and it was just like, boom. So I've been very disappointed, with Liz. I just feel like she's tried to undermine Dr. Nevin numerous times throughout my tenure here. And I felt like we got thrown under the bus, our group did, and we tried to do the best that we can for everybody in our community because we love being on this board and we love what the health department does. I mean, the potential, the goodness of the health department, what it can potentially do, but there's also a dark side. So as I'm going through and just picking out stories, it's very, I think it would be very confusing for a lot of people, because if they watch the news and they see what the CDC and the HHS and DC have to say, the way they've switched around, like as far as COVID vaccines, the requirements, and President Trump talked about slowing down the vaccines, so you don't have to give those kids all those vaccines, they get 72 up to age 18. It's crazy when you look at the vaccine for these little ones. And, slow it down, let's pause it, let's slow it down, let's do some more research, let's change the formulation of the vaccines around a bit, make it more safe. The rate of autism is crazy. Let me see, I was writing this down today. These things I think about early in the morning. Rate of autism, 2022, it's 1 in 34 nationwide. Let me see, in the year 2000, the rate of autism was 1 in 150. In the 1980s, it was 2.5 per 100,000. So, and then also during that time in 1986, they had the National Childhood Vaccine Injury Act came into being. So then the vaccine companies didn't have to worry, about being sued, and then all of a sudden we had this proliferation of all these vaccines hit the market. And it's just nuttiness, I mean, all the stuff that's going on. So MAGA and HHS recommend one thing, and then the state of Michigan decides no. Michigan and 13 other states, all Democratic too, by the way. I don't want it to be about politics, but I'm just saying what it is, all Democratic states. So they decide that they don't have to listen to what the president or the HHS secretary have to say. They're just gonna, they're just gonna do their own thing. They're pushing back on the COVID vaccines for all Michiganders to find Trump's administration. The FDA approves now an updated warning in the labeling of mRNA COVID. So now they're doing a black box labeling because of the myocarditis and the pericarditis following vaccination. They don't recommend for pregnant women. They don't recommend for healthy children and pregnant women. They're not recommending the COVID vaccine, but the state of Michigan still is. So there's just so much confusion with everything. New childhood vaccination study highlights continued consequences of the government's aggressive COVID vaccine push. So, Michigan is just doing its own thing. They're not taking the advice. These are the same people that are giving our health department advice. And so, no, I don't trust. I'm glad to be on the board, and this is why I wanted to be on the board, was because, when stuff like this comes out, when people start acting tyrannical, we need to be able to stand up for our people. So I want to make a motion. I'm going to make a motion to send to the Board of Commissioners a recommendation to recombine the medical director and the health officer positions together because of loss of trust and confidence in the health officer. Because this just has, we need to have, a true path.
Hold on, you made a motion.
Oh, okay, sorry.
Is there discussion, or is there a second?
Support, second.
Okay. You can speak to it.
We just need to quit undermining each other, it's just ridiculous. So we just need to get on one true path, this health department does.
Madam Chair. See, that's a deceitful motion and support. These are the same people that fought tooth and nail to separate the positions. And now, they want the advisory board here to dare make that recommendation to the commissioners to combine the condition, which basically means get rid of Liz King and get Dr. Nevin.
I didn't say that.
Oh, we can read between the lines. Okay, so I say that, read between the lines. If you combine them, who are you going to keep? Because you can't keep Liz and let Dr. Nevin go, then we got to find another medical director. So it's obvious, excuse me.
Excuse you.
Can I continue? Can you please ask her to restrain?
Finish your statement.
I'm-
You have the floor.
Thank you. Then, reading between the lines, if they do that, what are they going to do? Let them both go and then find a medical director? This is all Dr. Nevin's push. He can't work with Liz King. Liz tried to work with him. She did try to work with him, and Monica, you know that. that she tried to work with him. Can you amen me on that?
I'm not making any comments.
Okay,
so
but
it's
you
my
know,
turn to speak.
okay, but you know, she tried. He wants total control and wants her gone. And is using this health board to help that happen. I do commend the commissioners that they did listen to us. We sent a letter to them. They can, beautifully draft it for us. But with our input, to trust us, you appoint us, trust our decisions to advise you. And they're using that very brilliantly now. They probably never thought this would really work for them that well. So the fact that they could actually point at us, well, but the advisory board, is their suggestion, it's not us, our advisory health board, with some very highly intelligent individuals there as advisors to do this. Here's another situation here. I told you last meeting, and I told them in the commissioners meeting, at their committee meetings, this was gonna happen. They're trying to get rid of Liz King. They want to now combine the positions that they fought tooth and nail to separate, and the people sitting right here were a part of that. Now want to, oh, wow, you know what? Let's go back to combine this position. This health board should not weigh in on that. I dare you. Anyone vote to weigh in on that to get rid of the health officer. That's basically what you're voting to do. And based on what you stated, I don't trust Liz anymore. She did this nonsense about that email. We don't trust Liz. We're disappointed. She drew us into this. That whole health clinic thing we were aware of, it wasn't her fault. What happened? That health clinic was given money. There was already money there for the health clinic to operate. It was already built in motion before you and I and others got on this board. And you choose to vote to shut it down under Dr. Nevin to abandon patients. I'm not done yet.
I didn't say a word.
I read your eyes. To abandon, no disrespect.
That was very disrespectful.
Well,
But
that's
go ahead.
your opinion.
And I'm entitled to.
Okay, and so am I. Thank you,
Continue.
Madam Chair. To accuse her of it's her fault that we didn't know what was going on with the clinics. That's nonsense. Your total goal is to get rid of Liz King because Dr. Nevis told you I can't work with her. He's to the point now he's saying, well, if she don't go, I go. That's nonsense. We know how this vote's gonna go, but shame on you. Shame on you if you vote to advise the commissioners to get rid of the health officer and hand it over to Dr. Nevin. I will fight that on another front, tooth and nail, and a lot of other people will. Trust me on that. And put your words right back at you when you said separate these positions. And now you need to explain why you want to combine them without showing that partisanship of following Dr. Nevin down that rabbit hole, doing what he says he needs to do. Get rid of Liz so I can have full reign. I want you to get rid of Kevin and get rid of Liz. We're going to watch and see what's happening. But trust me, commissioners, please send us back, Mr. Rusher, to the commissioners. There's going to be a fight on that.
Madam Chair,
Yes.
may I ask a clarifying point to Commissioner Rusher?
Sure.
I guess I need to speak up here.
Thank you.
If this motion were to go forward, what does that mean to the Board of Commissioners? Or if it fails, what does that mean? I would just like clarification so I understand what I'm voting for.
If the motion and you have a second, if it passes, it'll be put on the committee and then it'll be discussed at the Board of Commissioners if that's what we should do. What is currently happening, if this goes forward, is no way in relationship to what happened before. The Health Advisory Board had no position on when Dr. Mercantant did not include the county commissioners, and she was brought to private meetings that she was to notify the Board of Commissioners so we would be able to give answers to the public. She chose not to do that. And that happened multiple times with Dr. Mercantant. And what happened then is Dr. Mercantant, we said what we would do is open both positions up for applications. And she had the opportunity to put applications in for both. She was never fired. She chose not to put applications in. So she could have potentially continued as our health officer and our medical officer. So historically, that's what happened with that position. It's not the same as what being proposed now. So you guys got where you're at and the motion and where you're at, past actions have gotten you potentially where you're at. So you're going to be taking a vote, and then that will go to our board, and then we're going to, of course, take our due diligence, hopefully, and make a decision on that, either to combine them or keep them separate.
Mr. Rushing, you did. It would help us when you tell us why you separated the positions, why we were
Can you just
put
hold
them
on
together.
a moment, because Leanne had the floor.
I was just going to clarify, so intentionally, nothing was ever separated?
Correct.
Okay, thank you.
Could you please explain why they were separated? Because there's a reason, nothing happens by happenstance. There's a reason why you separated the health officer position from the medical director position. What is the reason? We need to know that before we decide to advise to bring them back together.
Monica, you're the chair. If you want me to get in a discussion with Kevin, I will.
You can answer that question, please.
What happened then, and I'll go back to December 31st, and I can't remember the year right now, it might have been 2020. She made 17 phone calls to different school districts, 1-minute phone calls. It was all documented. Back in October, prior to when she was doing the quarantine, and some of this, I'll give you my perception, and hopefully I'll get it as correct as I can. There was healthy students in our schools that if somebody determined that they were in contact with somebody that had COVID, and so whoever that individual, then what they would do is they'd have to go home and their household would be on quarantine from 5 to 10 days, even though they were 100% healthy. And we talked to her about that, and there was no enforceable, this is similar to what here, she had no resources to enforce her health orders in regards to quarantine. The sheriff was not going to do it, and she did not have the personnel to go to household to enforce the health directives that she gave. Now, the statutory duties, I don't think any one of us, and I know I wouldn't, get involved with the medical officer or the health officer. They have statutorial duties, and this advisory board shouldn't get involved. But what happened in that particular year is Dr. Mercantant was brought into private meetings with commissioners, so we weren't in violation of the Open Meetings Act, so we could ask her specific questions. She guaranteed that she would notify us prior to, because we are the Board of Commissioners, and we need to be able to explain to the public what's going to happen. It had nothing to do with her statutorial duties. What it did have to do is that we have to answer to the public. She does not, or the health officer does not. They're not an elected position, and neither is the medical officer. The Board of Commissioners have an obligation to be able to answer questions when the public calls them. She chose not to include us in her decisions, and she told her that, not a letter of reprimand, but this isn't going to happen again, and she promised that it wouldn't happen. Well, that was pretty substantial, the decision she made on December 31st of that year. So at that point, the county commissioners said, look, we're going to open both positions because of Dr. Mercantant's negligence toward if that's the right word, the right adjective, toward the Board of Commissioners, and that's what happened in that. It was her actions that made the Board of Commissioners take the decisions that they did at that time. If she would have notified us prior to, and it's her statutorial duty, we never would have questioned the statutorial duty, but we did question the way she went about it. She also did not include the superintendents, and it's all documented, I don't have it in front of me, but some of the superintendents she talked to for 1 minute. It wasn't trying to get their input to help her make a decision. She had already made her decisions. And how she came about that, you'd have to ask her. But the Board of Commissioners made their decision because of the negligence that she showed the Board of Commissioners, so we could not report to the public. We start getting phone calls, and we each represent 23,000 people. Of course, we didn't get that many phone calls, but we should be able to give a logical reason what's happening and why it's happening, and the statutorial reasons for that. That was not afforded to the Board of Commissioners. So the entire, how we got to where we're at with Dr. Mercantant, it was 100% her actions, and she knew what was going to happen. So that's what happened historically.
Commissioner, I'm sorry, I have to say this. For one, so basically you're telling us that that decision to separate the positions was to punish her. Basically, that's what you're saying. Secondly, that's a lie. She reported to Jeff Baum, who was the chair. It was his responsibility to report to the other commissioners. It wasn't her role to report to each commissioner. It's to the chair, who was at that time was Jeff Baum. So that is a lie that she did not do her duty. To make that clear, and it's too bad this is not on tape, but I want it on the record. That's a lie, Mr. Rushing, you know that. She reported that to Jeff Baum, who was the chair.
What you're saying now is definitely a lie. I agree with
Oh,
that.
Hold on.
What you're saying is a lie.
Hold on, one moment. Point of order.
The accusations, I think, that Kevin is pointing to all the board members, I think need to stop.
There's a motion and a
Let's talk
second
about that
on the
health board
floor.
flu.
I would like just to weigh in on this also. I believe those two positions were separated to have, so that no one had that kind of control, again. Because if you look at, I believe there's 83 counties in the state, and while many have combined health officers for multiple counties, I think there's only one other in the state that has a combined. Greg, do you know the number? Is there was only one, I believe,
right now.
that is also a medical director and a health officer. And those positions are kept separate, in my opinion, for a reason. And that's for checks and balances. And I can't support that for that reason. I think what happened in the past here with having a combined position shows us why that doesn't work. So.
It's working now.
I think personalities can always have problems, right? But I think there are ways to work through those. But there has to be give on both sides. Is there any further discussion on this motion? Okay. If you could do a roll call vote, please.
Leanne Klink,
Abstain. Do I need to give my reason, Monica?
Yeah.
I would like to research this more before I make a final decision.
Okay.
Carolyn Richards, support. Yes. Stephen Smith,
Yes.
Dawn Folk,
Yes.
Monica Standell,
No.
Kevin Watkins,
No.
Okay, that's a 3-3 vote, so that motion fails. It's a 3-2-1, so it still fails. Did you have anything else, Dawn?
No, that's it.
Okay. I guess part of my comment was going to be why combining the two positions to me is not a good idea, but I think we've covered that. Steve, I would agree, and I think I brought up last month and maybe even the month before about structure of this board and having goals. And I think in January, I think we really do need to have either a work session where we work on goals for the board, and have some, clearly defined things that we're going towards, and for the department as well. So I think that would be an effective use of our time. Yeah.
Monica, keep in mind, the date, you said January, because this board may look different, so you want to make sure the board is set.
Understood, but,
Okay.
thank you. Which brings me into my next point. We do have 4 seats that are open, and the Board of Commissioners did not act at their last meeting because, well, actually, it would be this meeting, but they discussed it at the committee meeting, but Lisa Beeden was not there, and she did want to be part of that conversation, and so they made the decision to defer it until the January meeting, and that will be before our next meeting, so that we would have a quorum. Yeah.
Because January 1st falls on New Year's Eve, our meetings are going to be the second and fourth Thursday. So what'll happen with that, our first meeting will be September 8th. Then add 22 days.
January.
January 8th, and then our full board meeting will be January 22nd. So I believe that the board is going to take final action at the committee meeting.
At the 8th, yeah.
So that positions are filled and there's no, and that was part of the concern with Paul Zeller also. Is this going to cause a hiccup as far as anything? If that's the right word. He used a
Right.
different word, but no, with the, so I believe it's going to be final action at the January 8th meeting.
Correct. Okay, thank you. To your point about feeling blindsided by the June, so,
So we could talk about the modeling and, you know, how the.
correct,
building-
but Dr.
process.
Nevin's memorandum came out that said he was no longer going to provide medical direction
That
for
was-
those two clinics,
That
and
was
that's,
September 18th, or
no, no, that was in June. You put that memorandum out in June, correct?
Yes, Judy.
Stand by. I'm happy to clarify the timeline.
It was
Of course,
June or July, because we had that meeting in July that I attended with Bob. And so that was the first conversation that happened regarding that. So that wasn't, it was
And
blindsided for
that
the
wasn't
only,
a health department either meeting. That was, I mean, that was with the
Yes.
health department, not with us, the board.
correct.
Yeah.
And we reported back to that meeting at the next meeting. He's gonna get the date of the memorandum, but that's where that all came from. So that was all at the same time. That was, this board was advised as soon as that came out because he issued the memorandum. So I don't think there was any blindsiding to that. Well, I was blindsided by the fact that he wasn't gonna provide medical oversight anymore. But as far as, everybody on this board had the same information.
no, so if I could clarify, after an extended period where I attempted to resolve these problems within what I assumed was my power as medical director, I had no choice but to memorialize my direction in the form of a memorandum, making clear the direction that I had expected the department to implement, as the division of roles suggests. And I suspect that my being essentially forced by circumstance to memorialize my instruction in that manner served the interests of those who opposed my direction. Right? I would have preferred if my attempts in the months preceding that memorandum to have my concerns taken seriously by the administration and the department. I would have preferred if my attempts to have done so did not have to result in so public an airing of our laundry. But this speaks to what I believe is increasing dysfunction with the division of roles in our department. As I have expressed in my memorandum to the Board of Commissioners, which board members may have seen, the traditional division of roles, which it is correct, I believe most local health departments do now divide the roles, but this is predicated on there being broad agreement in vision between the medical director and the administrator, right? Between the medical director and the health officer, who has the managerial and supervisory authority to implement the medical director's medical vision. Now, it's no secret that my vision for medical direction differs very significantly from what we had in this department previously. In fact, I would suggest that this is why I'm still here. As we all recall, after a year in my position, it became clear to all parties that the relationship between the health officer and myself was simply not working. The health officer was doing the bidding of the state in encouraging me to leave my position because the state was unhappy with the positions which I had taken on many controversial topics, which I believe the majority of county residents support, which of course underlie the reason why I am in this position in the first place. Right? And not seeing a resolution to that tension, I voluntarily submitted my resignation. And it was only because the county commissioners were concerned at my having submitted my resignation and wanting to know what was the source of this dysfunction in the department, that I accepted the invitation to rescind my letter of resignation, and the board supported me in that. And although there was no formal agreement of any kind, I think it was tacitly understood by all parties to that decision that there would be changes made within the department such that I, in my role as medical director, could faithfully direct the public health and medical activities of the department, as I believe a reading of statute and regulation calls for. Public health, local health is fundamentally a medical activity. It requires medical direction. And as medical director, I count upon the faithful implementation of my medical direction by staff. And I think, as some of the comments were alluding to, it's not clear whether there has been that faithful implementation of my medical direction in recent months. As we've seen, it is very often like pulling teeth. And I think this arises from a fundamental difference in opinion between the health department, administration, and myself. I believe that as medical director, I should be directing the public health activities and direction and very clearly the medical activities of our department. And the health officer has very clearly stated that she's welcome to correct me if I've misspoken, but I believe the health officer would agree that she essentially has a veto over my medical direction. As we saw with the health officer's attempt to hire a medical director that would be given the very responsibilities that I have as medical director in my contract. And I explained to the health officer, I considered that proposed contract to be violative of my employment agreement, because my employment agreement gives me authority over other clinical staff, it gives me authority over medical standing orders, and it assigns me responsibility for medical direction, which is everything clinical in the department. It's everything. And so the drama that we've seen in recent months fundamentally has resulted from the health officer not respecting my authority as medical director, in my opinion. And so I can't presuppose to know the rationale for members proposing this resolution today, but I imagine it stems from a sense among advisory board members that this division of responsibility is not working in our particular case. And I would concur. I am in fact on record as saying it is not working. And I don't anticipate that the current division can continue in its current form indefinitely. I don't want to imply any sort of ultimatum. I'm happy to stay in this position as long as is necessary. I am here because the board wanted me to be here. I had submitted my resignation and it was not accepted. And so I am here entirely at the pleasure of the Board of Commissioners. I'm here because the Board of Commissioners wants me to be here. But I think implicit in my being here is an understanding that something at some point will change, either a formal delineation in our respective contracts to re-emphasize my role as medical director and that I shouldn't have to pull teeth to have my medical direction implemented by department. Perhaps that's one solution. Another solution is as has been recommended. It's up to the members of the advisory board and it's up to the Board of Commissioners to determine how best to resolve this impasse. And make no mistake, it is an impasse. Ultimately, I believe that the decisions that have been made in this regard, including with our former medical health officer, have all been made in the name of improving government efficiency and improving our representation of what our people want, right? So the decision to split the roles, in my estimation, as someone who wasn't in the county but who reviewed the events in question when considering taking this position, it was my sense that the position was not serving a role in efficiently running the health department. It was introducing all sorts of drama, right? And there was a significant public displeasure. And the health department was not reflecting the will of the people. And so the decision, in my estimation, was made to improve that. And I believe we find ourselves in a similar situation today, right? There's been gross inefficiencies. We've all spent considerable time discussing matters which should have been addressed internally, I think. And I think there's a legitimate question as to whether the health department is truly representing what the people of our county want. And I have tried to faithfully represent what I believe are the emerging desires of the people, you know, with my perspectives on vaccines, with my perspectives on policy, with the work I've done on the solar regulations. I have tried to fulfill our role in performing public health to the standard of our public, not the people in Lansing and not necessarily the people in Atlanta.
If I could just cut you.
Yes.
I was just wanting to know about the date that you put that memorandum
Oh, I'm sorry.
out.
It's right here.
So the memo was put out August 1st,
So-
but preceding that, there were months of discussion, which the advisory board was not made aware of it. And my expectation was that these concerns could have been addressed internally. But because of this impasse, which I've described, they could not be addressed internally, and the department had to air this dirty laundry, as we've seen.
Excuse me, Madam Chair, if I may. We had that meeting July 16th, and this memorandum came out August 1st. So it was after that July meeting that I was speaking of.
Right, but he already had said what that was going to be. You had made it clear that that's what was coming out.
Not-
Yes, so
not
we
during
had
that
discussions in the department preceding this, and it was my hope that we would be able to resolve these concerns internally, but that did
Correct.
not,
Okay.
that was not obviously how things were resolved.
Thank you. The health education concerns, I would also get on board with having great concerns about what came out of MDE. And they completely ignored the vast amounts of people that came and spoke against these mandates or these new rulings that they want taught, and completely ignored the public on this issue and just pushed through what they want. And I'm not sure how we combat that. I don't know that that's this board's responsibility or job to do that, but,
They're guidelines right now,
well,
guidelines.
they're going to be,
Yeah.
yeah, they're going to be mandates. Yeah.
Two things, just so you guys are aware of it. Historically, Jeff Bohm did support separating the two positions. So as far as that, as far with Dr. Mercantan. And in regards to the contracts for the medical officer and also our health officer, but it's similar to what you guys have. You have your bylaws and duties that you have to do until it changes. That's what you got.
Right.
Same thing now with Dr. Nevin and also our health officer. It is what we got. We are looking to change that language, and we're running it by corporate counsel to where, I'll give you my viewpoint of it, because every commissioner, you'll look at something and it's called a German philosopher Gestalt. You could read this paper, somebody else could read the paper, and you're putting it in good form in your brain that you think you see it. Why don't you see it? Well, I don't see it the same way.
Right.
But anyways, the commissioners will be addressing that, and I think sooner rather than later.
Right, because
Just so
both
you're
of their
aware.
contracts are June 30th, correct?
I'm not sure the exact dates, but
I believe so.
without knowing otherwise,
Yeah.
either way, it needs to be corrected, I believe, and the commissioners will be able to take their position if they think that they should be co-positions rather than one subordinate upon the other.
Yeah, and again, I would just go back to they were separated for a reason, and there was an overwhelming public support of the positions being separated. And I don't think that that has changed, but we'll leave that to the people at this point.
Madam Chair,
Also-
if I could, in relation to your question about the education guidelines, there is, and I would ask the board perhaps for guidance in this regard, because in the same way that I attempted to respond to public concerns about the health effects of solar developments in our county, and I put out those interpretive memorandums, which subsequently became the impetus for our health regulations. I believe that there is just as solid a legal basis and a public health rationale for to regulate in this area. There's legislation that defines what sex education is, or at least implies a definition. And fundamentally, public concerns in this regard relate to the fact that what the state is suggesting is fundamentally sex education, right? Whether it applies to an aspect of human sexuality or the act itself, it is an aspect of sex education, in my opinion, and I sense in the opinion of many members of the public, and therefore the public is asking for this to be optional. There is a potential role for us in the Health Advisory Board and in the Health Department to issue regulations that would better define these terms to be more in line with the public's understanding and the public's preference, and that would result in protecting the public from the harmful effects of exposure to this potentially harmful material. I think at the board's discretion, we can defer this until the new year, but we can discuss potential regulatory action that would include real teeth, right? The Public Health Code provides for there being misdemeanor offenses for violations of local regulations. We can potentially discuss very stringent local regulations that would define what is and is not considered sex education for the purposes of St. Clair County schools.
I think that would be a January discussion. That would be a good January discussion. So thank you all for coming. I would wish everyone a Merry Christmas and a Happy Holidays for what you celebrate. And I would take a motion to adjourn.
Motion to adjourn.
Second.
All in favor?
All right.
We are adjourned at 11:50.
No.
So they had the video started soon after we resumed our meeting, so there should be a recording of this meeting.
Dennis just checked that. It's still separate.
Yep.